alongside us, but obviously patients can also be seen in their own homes, and I think that initiative is something that really patients and carers have appreciated a lot.
The Society supports information, advice and care for people with dementia and carers. In Surrey we have a range of different services, day support services, home support, support groups, both those for people with dementia and also for carers, and we have dementia cafes and singing for the brain groups. Our work with Surrey County Council and Surrey Health includes trying to help all organisations working in the field of dementia with training and focusing care, particularly in hospitals, and how people are supported on hospital wards with our county hospital at the Royal Surrey and other hospitals across the county as well. Helping to encourage people to not go into hospital, helping carers understand coping mechanisms and ways of supporting somebody for longer at home, but if by necessity they have to go into hospital, helping the hospital understand the needs particularly of people with dementia, and trying to encourage people to come back out into the community rather than having to go into a care home, which sadly seems to happen quite often.
What we actually did is we did a 9-month trial within the Surrey region, specifically looking at target areas to take our already good and excellent service and take them to the next level. And one of our core values is seeing our services and seeing life through the eyes of our customers and our service users and residents. So what we did is we created an experiential training package where the staff could really get a feel of what it might be like to be an older person living with dementia. There's lots of games and active discussion and involvement, and all the staff within the care home environment actually undertook the training. We also look at creating quite homely and friendly environments. So we looked at the use of retro style, so 1950s, 60s, 70s style lounge areas, and cues and clues to help people find their way around the home.
The facilities that we have here, we have a day centre, which is the gateway to go on to respite and even to permanent care. We also have a tea room here. We've got chickens, which is for animal care. Again, it's for the service users. The idea behind it is all activity-based care. It's ABC. Activity-based care is all about having something that the service user actually feels complete with what they're doing. And we've also got a pamper room. The pamper room again is for one-to-one time with that service user, and it's also taking them out of their everyday environment. We actually have a swimming club. This is very new to Kingsley, and there's been such an impact with this swimming.
I work for Friends of the Elderly. My role is specifically to engage with the British Asian community of Woking, raising their awareness of dementia and encouraging people to access help and support. Most of the elderly people in the black and ethnic minority communities are taken care of at home by their family members. So it is very important for me to bring it across to them that they can access service and they need to be better informed in order to take care of their elderly at home.
In Surrey, there are currently over 14,000 people living with dementia. This figure is predicted to rise by 46% by 2025, generally due to people living longer and a combination of lifestyle and environmental factors. Age is the predominant factor, although dementia is not exclusive to older people. Younger people from their mid-30s onwards can develop what we call early onset dementia. People with learning disabilities are also at greater risk of developing dementia. Across Surrey, health and social care organisations are working closely together with the voluntary sector to develop world-class dementia services that will support the growing number of local people living with dementia. We are planning a number of changes that will improve access to information, support and services. 1. Launching a public awareness campaign. 2. Creating a dementia navigator role where the individual living with dementia is supported from diagnosis throughout their illness. 3. Ensuring more people are supported at home rather than in hospitals or care homes. 4. Creating local memory services where people can be assessed. 5. providing specialist home care services. 6. Ensuring more support for carers. 7. Promoting telecare equipment that can help people live at home. 8. Providing personalised services in residential and nursing homes. 9. Ensuring easy access to tailored day services. And 10. Delivering good services for young people.
I tell everybody about it, you know.
So much proud of it.
Might as well.
I think you're very good at that for living well with dementia.
Receiving a diagnosis of dementia is serious. We are trying to encourage people to live well with dementia. There are ways of supporting people and their carers to continue to live active lives in their own communities. For information on the condition, diagnosis, symptoms and carer support, please visit these websites. The Alzheimer's Society website at www.alzheimers.org.uk. Their telephone number is 0845 300 0336. The Department of Health website at www.dh.gov.uk. And for information on mental health services in Surrey, visit www.firststeps-surrey.nhs.uk. And we have our own information point. The Surrey Information Point website is at www.surreyinformationpoint.org.uk.